Hello and welcome. Before we get started on the lesson, let's talk briefly about hypertension. It's defined as a systolic blood pressure of 130 or more, a diastolic blood pressure of 80 millimeters of mercury or more, or a patient is on medication treating hypertension. Those are the three diagnostic criteria. It's rather prevalent. For example, between 2017 and 2018, the CDC reported that all genders had it at about 45.5%. It was slightly higher for men at 51% and slightly lower for women at nearly 40%. Likewise, it changes with age. So, for example, those between 18 and 39 years of old, only about 22.5% had it. However, it was had a prevalence of nearly 55% for those between 40 and 59 years of age, and a 75% prevalence for those of 60 years and older. In summary, it's rather prevalent, so having a really good understanding of hypertension, how to treat it, is very important. Here we're going to talk briefly about the drugs that are used to treat it. Now, we're not going to talk about the other treatment options, which are lifestyle and diet. We're simply going to focus on the various drugs that are used to treat hypertension. And those include beta blockers, alpha blockers, alpha-2 agonists, renin inhibitors, and vasodilators. Likewise, there are diuretics, calcium channel blockers, or CCBs, ARBs, which are angiotensin receptor blockers, and ACE inhibitors, or angiotensin-converting enzyme inhibitors. Now, under the diuretics, there's a handful of those. There are carbonic anhydrase inhibitors, osmotic diuretics, and vasopressin receptor blockers, as well as potassium-sparing diuretics, loop diuretics, and thiazide diuretics. So this is the list of drugs that are used to treat hypertension. So let's get started with today's lesson. In this lesson, we'll talk about thiazide diuretics, which will include a brief overview of the other clinical applications, its adverse effects, and mode of action. For all 13 lessons, you can visit lancemillerphd.com. Simply sign up. It's completely free. There, you'll get the video tutorials, printable concept maps, and a 30-question Step 1-like quiz at the end. Thanks, and let's get started on this lesson. Hi, and welcome to this introductory lesson on thiazide diuretics, which is the first lesson in our overall short course on thiazide diuretics. Thiazide diuretics work by inhibiting the sodium chloride cotransporter, which leads to decreased sodium reabsorption along the distal convoluted tubule, and then ultimately a decrease in extracellular fluid volume, which is why it's used to treat essential hypertension primarily, and secondarily can be used to treat heart failure. And typically, loop diuretics are used to treat heart failure. Thiazide diuretics can be used in conjunction with those. Because of the decreased extracellular fluid volume, that can lead to one of the adverse events, which is hyperlipidemia. We'll talk about that mechanism. Another adverse event is hyponatremia, and that's because the decreased fluid volume leads to an increase in water intake and decreased water excretion by the kidneys. So you're taking in more water and you're retaining more water, which dilutes out the serum sodium, and that's what leads to hyponatremia. So while that's not a good event, because it does lead to increased water intake and decreased water excretion, it is a good drug to use to treat nephrogenic diabetes insipidus, and we'll talk more about that in detail. However, the most common side effect, and you definitely need to know this, is hypokalemia. Now, thiazide diuretics cause that, as well as loop diuretics, using the same mechanism. The decreased sodium reabsorption along the distal convoluted tubule causes more sodium to be delivered to the collecting duct, where it is reabsorbed by the epithelial sodium channel. In exchange, potassium is secreted along the same segment of the collecting duct. And so that's what leads to the hypokalemia. Now, in turn, hypokalemia can lead to metabolic alkalosis, which is another common side effect of thiazide and loop diuretics. And that occurs by three main mechanisms. One of them is increased hydrogen ion secretion along the collecting duct. Another is increased ammonium production and excretion along the proximal convoluted tubule. And the third is an increase in hydrogen ion uptake into cells in exchange for potassium. Now, in addition to inhibiting the sodium chloride cotransporter, which leads to decreased sodium reabsorption, It also leads to increased calcium reabsorption along that same segment. Because of that, it can be used to treat idiopathic hypercalciuria, which is increased calcium in the urine, which leads to or increases the risk for calcium-based stones. And the other is osteoporosis, to reclaim as much calcium from the urine as possible. And because of that, it can lead to hypercalcemia. It's not common, but it can happen. Now, another common side effect is hyperuricemia, which can lead to gout. And that works because thiazide diuretics, as well as loop diuretics, are secreted along the proximal tubule. And they're secreted by these organic anion transporters, which, by the way, secrete uric acid. So in the presence of thiazide diuretics and loop diuretics, less uric acid is secreted into the lumen and more of it is retained in the serum. That's what leads to the hyperuricemia and gout. Now, another side effect is hyperglycemia. And finally, thiazide diuretics, along with loop diuretics, can cause sulfa drug allergies because they contain sulfa moieties, and we'll talk about that. So here's the overall concept map that we're going to cover in all of the following lessons. You feel free to move around to any one of the lessons that you want in any order. At the end of each lesson, you'll have access to this complete file here, as well as a blank version of the concept map so that you can use that to test your memory. I highly encourage you to do that because many of these nodes here, the descriptions of the nodes, will be answer choices in Step 1 and comp exams. So thanks for listening, and I wish you the best of luck. For access to all the lessons, printable material, and quizzes on this topic, visit lancemillerphd.com. And if you like this video, please like and subscribe. Thanks for watching.